Hello and welcome to today's demonstration of CareGo. When we set out to build CareGo, we wanted to design something that fit into caregivers' everyday life and made it a little bit easier. Every feature, every design decision was based on research and testing with actual caregivers. And I believe that has helped us create an experience that allows caregivers to be empowered and to give the caregivers back time with their loved ones. I will try to bring CareGo to life for you by telling you the story of Maya and her mom. Maya is married, lives in Chicago, has a couple of kids, and she and her husband are both full-time working professionals. She has recently started providing care for her mom, as her mom's Parkinson's and osteoporosis have worsened. Maya is finding that she is struggling a little bit to juggle her job, her kids, and her mom at the same time. And let's meet Rebecca. Rebecca is Maya's mom and a grandmother. She's still pretty independent, she can live by herself. But clearly things are getting worse over time. And both Rebecca and Maya recognize that maybe it's time to seek some help, to put a plan in place. Maya has CareGo as a benefit through her employer. And notice here it says she attended a webinar to learn about CareGo. The way we'd like to work with employers is to engage with your employees, through education, through marketing, through webinars, and through other media to highlight that this benefit is available to them. And from an employer's perspective, we have made it very easy to onboard your employees onto our platform. All we ask for are name and email addresses, without having to worry about complex eligibility rules or technical integrations. So after Maya first creates her account and logs in, she takes this short assessment so we can learn a little bit more about her as well as about Rebecca. This assessment takes about 5 to 7 minutes and covers Rebecca's health, living situation, Maya's needs, and her challenges. While going through this onboarding process, Maya can invite her care team onto the platform as well. She might invite her husband, or Rebecca's neighbor, or even Rebecca herself. And Maya has complete control over which members of her team can see and access which parts of the platform. For example, Maya might not want the neighbor to see Rebecca's will, which Maya has added to the platform for reference. After Maya completes her assessment and onboarding, she's taken to her dashboard. On this dashboard, what we've tried to do is provide a space for Maya to fully organize her life as it comes to providing care for her mom. So I will walk through the key features shown on here. First, starting with some of the technology aspects that we built to enable Maya to use CareGo as a self-service platform. And this is very important, especially for employers, because we're providing the ability for Maya to be more productive by getting her answers quickly, through the platform, without having to wait for an appointment or spending hours on research. But then, I will also talk about the human element which we have incorporated into the platform. And we believe that is what really brings technology to life, and makes everything here much more actionable. First of all, I want to talk about our care plan. After Maya's answered her assessment, the system actually generates a care plan for her in the form of to-dos and action items. These to-dos are specific to Maya's situation. For example, winter-proofing Rebecca's home before winter to prevent a fall. The algorithms for generating the to-dos have been designed by a professional care team. In fact, after the system generates the initial plan, it is also reviewed by our care advising team, who will further consider Maya's unique situation to refine her care plan. For example, the system-generated plan will be refined after taking into account the complexities and comorbidities of Parkinson's and osteoporosis. And of course, Maya can create her own tasks and her own plan in the platform. So, for example, maybe Rebecca needs to go see the physical therapist next Wednesday. Maya can create this task with all the pertinent details about the appointment and ask Sarah, who's Rebecca's neighbor, to drive her to the physical therapy appointment. The tasks can all be synced to care team members' personal calendars so everyone stays organized. Our goal was to integrate the platform into Maya's day-to-day life, and beyond this calendar sync, the entire platform has been designed to promote convenience for Maya. I'll talk a little bit about the care binder, but there's actually a lot to unpack here, and I cannot cover everything on this video. What I will try to do is give you a flavor of the functionality we've built. We've organized the entire care binder in different topics and sections. So for example, here you can see financial and legal, medical, and daily living sections. And each section is a hub to allow Maya to organize information about Rebecca that is going to be important for providing better care to her mom. For example, under the financial and legal tab, Maya might upload Rebecca's living will, and manage the process to become her mom's power of attorney. Under the Medical tab, Maya can track what medicines Rebecca is taking and when. Under Daily Living, Rebecca can track her weight and food intake if needed by the doctor. When we were designing the platform, we learned that professional care teams in hospitals have literal binders. We have digitized that binder and made it available to Maya and Rebecca at their fingertips. But technology can only help Maya so much, and through CareGo, Maya also has access to our professional care advising team. Once Maya completes her assessment, she's paired up with the care advising team, in this case led by Neelan. Neelan is a social worker and she leads the care team that's been assigned to Maya and Rebecca. The team assigned to Maya is made up of 4 to 5 care advisors who work closely together to handle cases like Maya's. Every care advisor on the team is qualified as a nurse, social worker, or as a domain expert. Neelan will take lead and be the primary contact for Maya, but in case Neelan is not available, one of the other care team members will be available to respond. We built the care advising model with the intention of balancing personalized attention with quick response times. So, everybody in the care team gets to see all of Maya's and Rebecca's information and are able to back up Neelan if ever needed. Let me talk a little bit about how Neelan and the advising team interacts with Maya. Initially, Maya will receive an introduction from Neelan asking her to set up an introductory meeting. During this introductory meeting, Neelan and Maya will go through the care plan and discuss Maya's needs. The care advising team can help Maya with booking appointments, understanding diagnoses, helping guide with insurance plans, and generally serve as a trusted advisor to Maya and Rebecca. Maya can continue talking to Neelan through the messaging system at any given point, bringing up issues as and when they come up. The one-on-one care advising sessions are also available as Maya needs them, as she comes upon new challenges and new problems while she's providing care for Rebecca. I mentioned earlier that we really focused on building CareGo into an action-oriented platform. And so in addition to all the great advice and tools, Maya also has access to a great marketplace for whatever products and services that she is looking for. Through our curated marketplace, we are able to provide services like in-home care, meal delivery, transportation, handyman services, and everyday things that a senior person or a family caregiver might need. We also offer thousands of products at discounted rates, covering needs from nutrition to incontinence. We also offer financial and legal solutions covering wills, trusts, fraud protection, bill payment, and banking for caregivers and their families. We have negotiated discounted rates with each of our vendor partners, so Maya and Rebecca can get discounts for products and services purchased through CareGo. Finally, we offer vetted educational content with practical, science and evidence-based knowledge. Users will have access to a content library and the care advising team will also surface education as appropriate. So, going back to our real-life example of Maya and Rebecca, how would Maya use all these services together? Well, let's imagine that maybe Rebecca takes a fall and she's injured herself and ends up in the hospital. Now Rebecca needs care all the time, because she is immobile. Let's see how can CareGo help in this situation. Maya reaches out to her care advising team and asks for advice on what to do next. Neelan works with Maya to understand what benefits are covered under Rebecca's health insurance, and consider options for in-home care for Rebecca. Through CareGo, Maya and Neelan are able to find an in-home care provider for next week, so Maya can go into work and discuss a plan with her employer. Maya also needs to purchase a walker for Rebecca, which she is able to find on the platform as well. Hopefully, that illustrates how CareGo can help someone dealing with day-to-day and unpredictable problems. And CareGo's breadth of services, designed to make the experience easier for Maya, is what sets CareGo apart. We set out with the intention of providing clarity, empowering action, and ultimately alleviating burdens for the family caregivers. And our goal is to give Maya her moments back with her mother so they can enjoy their time together.